Okay, hello everyone, and welcome to today's session on multi-level programming, layered support for adolescent girls. My name is Emily Schaub, and I'm a Gender and Development Specialist with ICRW. As we get started this morning, please ensure your microphones are muted for the duration of the session. We will have an opportunity for Q&A with our speakers in the second half of today's session, so please just submit your questions if you've got them in the Q&A function at the bottom of your screen. And if you're having any trouble hearing our speakers, viewing the screen, or any other tech issues, you can just put that into the chat function and someone from our team will assist you really quickly. Today's session will feature 3 different projects which were funded by the Bill and Melinda Gates Foundation and which were part of the Gates Foundation's Women and Girls at the Center of Development Learning Agenda, which was a partnership between about 30 organizations working in 14 countries to identify innovative, evidence-based solutions to the most pressing issues facing women and girls. To kick things off today, please join me in welcoming Dr. Ravi Verma, Director of ICRW Asia. Ravi leads ICRW's local and regional efforts in Asia to conduct research, provide technical support, build capacity, and partake in policy dialogue on an array of issues. He has more than 3 decades of experience in programmatic research and evaluation in the areas of family planning and reproductive health, gender mainstreaming, and HIV/AIDS in India and throughout Asia. Go ahead, Ravi.
Thank you. Good morning, good evening, good afternoon to each one of you. I'm really thankful to each one of you for having taken time out from your other commitments to participate in the first of the 2 exciting webinar series we are organizing on the issue of multi-level and multi-layered interventions to empower adolescent girls and address their needs comprehensively. The need for comprehensive programming for girls, for adolescent girls, is not new. A lot has been written on the topic, but the attempts to translate the ideas of some of these complex ideas of comprehensive programming in the real life situations are far and few in between. With multiple programming also comes multiple challenges. Besides logistics and operations, I think one of the biggest challenges is to bring together different stakeholders onto the same conceptual page or raise the same levels of clarity or the sense of purpose. Then the question is, how does one draw learning from such multi-layered programming? Can outcome-oriented evaluations really tell the multi-layered and nuanced stories of change? In my view, that many of them are very likely to remain under the radar till they reach a threshold. And what is that threshold? I think on top of it, the changes don't happen at the same rates or with equal depths at all platforms and institutions or even different beneficiary groups that multi-layered programming tend to address. How does one account for the time lag or different levels of resistances in these change processes? And what do these interventions do to sustain some of those facilitative change processes and weed out the barriers even beyond the lifetime of the project? One of the projects you'd hear has implemented programs in 5 different sectors, namely education, marriage, sexual and reproductive health, nutrition and food allocation and life skills, whereas the other has combined sectors of economic empowerment and education and has worked not only with the girls, but also with boys and significant others in different settings. I look forward to learning from these presentations, exciting, insightful presentations. The tangible ones, of course, but also about intangible ones that might have had a profound impact, but may not have been measured in tangible ways. I really thank all the presenters and all the, our chairperson, our Catherine, Dr. Shubha Chakravarty to be here and to shape the discussions. I welcome you all once again and look forward to some exciting discussions. We have the second one on the 14th of April in this series, and I hope many of you would be able to join. Thank you so much. I hand over the platform to Emily now to take this forward. Thank you so much.
Thanks for getting us started today, Ravi. I'd now like to introduce our 3 panelists. Ms. Gcinaphi Ndlovu is the project manager with the Swaziland Action Group Against Abuse in Eswatini. Gcinaphi has served as a Girls Empowerment Club coordinator for the research-based intervention testing the effectiveness of the curriculum. She is currently managing a project focusing on HIV prevention and GBV response, and provides oversight and coordination to the implementation, including planning, grant management, supervision, stakeholder engagement, and communication of activities for SWAGA's prevention program. Our second panelist will be Ms. Alem Agazi, who is a sexual and reproductive health and nutrition program coordinator with CARE Ethiopia. She's a public health professional with almost 20 years of experience in program design, implementation, management, research, and monitoring and evaluation. Through collaboration with CSOs, INGOs, government, and bilateral counterparts, she has worked to advance best practices in Ethiopia and globally. And finally, Dr. Prerna Kumar is a technical specialist with ICRW Asia, where she leads Planet Girls, a research intervention aimed at enabling young girls to transition from education to employment. Prerna has extensive experience in social science research, program evaluation, policy review, behavior change communication, capacity building, and advocacy. Her work has focused on HIV, maternal and child health, sexual and reproductive health and rights, gender and health and technology, and she has managed countrywide research projects and program evaluation studies for various national and international organizations. I'll now turn things over to our first panelist, Gcinaphi Ndlovu of SWAGAA, and I'd like to remind the audience to please post any questions in the Q&A box.
Thank you, Emily. I'd like to greet everyone. I will be speaking on the Empowering Girls for Improved Health and Wellbeing project that we conducted in Eswatini over a 2-year period. The challenge, Joe, please move to the next one. The challenge that SWAGAA focused on was regarding healthy transitions to adulthood amongst adolescent girls, because those are hampered by a cohort of critical issues, including high rates of GBV, unsafe sex, heightened risk for unwanted pregnancy and HIV, and lack of agency, social isolation, and school dropout, and economic vulnerability. SWAGA's role in this project was to strengthen girls' agency and protective assets for improved gender equality through girls' empowerment clubs, an increasing percentage of girls who tell someone about abuse they have experienced and seek services for it. We also involved boys to reduce the risk for perpetration of GBV and as potential champions towards gender equality. Next. So SWAGAA, in collaboration with the Ministry of Education and Training in Eswatini, as well as the Population Council and Together for Girls, implemented a school-based project in 30 primary schools. These were divided into 3 study arms, and we were targeting girls and boys aged 9 to 14 years at baseline in grades 4 and 5. So the 3 study arms included the girls' clubs only. These were in 10 schools, and we referred to these as the GC. We had 10 GC plus, which were schools with girls and boys clubs in the same school. And we had 10 control schools where we didn't have any intervention over the intervention period. We also did engage some government agencies at local level, and the project also built national and local capacity and strengthened program sustainability, mainly through the training of the Ministry of Health workers, where we were looking into issues of adolescent-friendly services in local clinics. Next. With the adolescent girls, we worked to improve self-efficacy and build social assets through the provision of a safe space for girls to attain GBV knowledge, as well as HIV, and build their social assets and self-efficacy. And this in turn would hopefully improve health services or linkage to health services. We also sought to increase girls' use of post-GBV, HIV, AIDS, and care and support and SRH. With the adolescent boys, these were complementary clubs or engagement of boys to address social norms, underlying social norms, to address harmful perceptions, stereotypes, and also bring attention to challenges experienced by men and boys as a result of these harmful aspects of masculinities that we see in our society. Next. we conducted, so the sessions are run by mentors who are trained extensively using a gender transformative capacity building approach. This is usually a 5-day training that is followed up by refresher trainings every 6 months. Supportive supervision is conducted every month or on a at regular intervals. 2 mentors. Focal teachers also received gender transformative capacity building. They were responsible for administrative support and supervision of mentors and the scheduling of clubs and encouraging members to participate in the clubs. Head teachers also underwent gender transformative orientation for understanding and project buy-in. This was to ensure that allocation of time and space was afforded to the clubs over the duration of the intervention. These were followed up by monthly school visits and annual collective sharing and learning meetings. Next. With the program works, and we found that 5.6% of girls had experienced sexual abuse in the last 12 months or in their lifetime. And this was compared to 11.3% at baseline. However, the intervention was more efficacious for boys than girls, as we saw higher disclosure and service-seeking behavior from survivor boys. And we are positive that is a possible pathway for less future perpetration. Next. Our biggest success for the Empowering Girls for Improved Health and Wellbeing program is the impact on participants disclosing and seeking services, as the name implies, after experiencing violence. This was compared to the VAC study that was conducted in 2007, where service seeking rates were far less than those reported by the EGHW girls and boys. So the GC Plus, as you can see, it was more impactful in terms of disclosure and service seeking. It was also, though, more efficacious or more effective for boys' experience of physical abuse or service seeking thereof. For both genders, the GC plus levels are by far the highest reported in the region, as 2 to 27 and 4 to 8 times higher for EGHW girls and boys respectively. As I've said, the program is more efficacious or was more effective for boys because it focused on gender transformative modules, critical self-reflection regarding gender beliefs and behaviors pertaining to violence and relationships. Next. And thank you.
Thank you so much, Gcinaphi. Our next panelist will be Alem. Alem, please turn on your video and you can begin.
Okay, okay, sorry. For the connection issue, I'm not going to use my video. Otherwise, I'm afraid that the connection will be weak. Okay, thank you. So what I will be presenting is CARE Ethiopia multi-sectoral adolescent empowerment project. It's called Abdi Boru. So for this project, CARE was implemented, and there was a local training and research institution that did, the evaluation and the research for this specific project. It's called ACIF, Addis Continental Institute of Public Health. Okay, the rationale for multi-level program, the challenge, it was to reduce vulnerability of adolescent girls who are at the early age range of this group and in the rural waste hierarchy of Ethiopia. And the CARE's role, as I have said, sorry, I have. Okay, sorry. CARE's role here is to implement a comprehensive intervention which worked across individual, community, group, and government levels. Thank you. Next slide. Okay, details of the multi-level program. As I have said earlier, the project was a research project and it has 3 arms. The first one was control. The second one is a double combination, individual and government level intervention in order to improve government responsiveness. And the third one is a triple combination that is a combination of the double one plus community engagement. Next slide. Okay. Okay. Evidence from this multi-level program, we have learned that it has, a wide range of impacts on, the girls' life, and we can say that it really works. We have seen that the early marriage, prevalence reduced by 44%. And the majority of adolescent girls reported high confidence of their own negotiation skill, with significant change observed between baseline and end line. And the other is the proportion of sexually active girls decreased. The proportion of adolescent girls who think they should have the same educational opportunity as boys and to negotiate for financial support is also improved. We have seen also nutrition related practices also improved significantly. When we say nutrition related practice, there is in the project area, there was discrimination for girls in terms of nutrition. There are some certain types of foods that are not allowed for the girls to eat, but it is allowed for boys and men. Okay, so we have seen improvement in this area too. Next slide. Okay, conclusion and implication. What we concluded from this multi-level multi-level societal issues by engaging other stakeholders, norm holders. Those are specific to the norms that are barriers for the girls' empowerment. And when we say SAA, it is an approach it is a type of community dialogue, but it is somehow also different from the well-known community dialogue approach that's contextual to care. And engaging community members is also essential in reducing early marriage. Working with young adolescent girls is also possible through, though it required extra efforts and resources. When we say adolescent girls, in this case, it is specific to early adolescent groups between 10 to 14. And the other thing that we have seen is, very young adolescents needs strong and continuous support to reduce their vulnerability. and also including boys in such project can also enhance the success of the intervention. And one thing that I would like to add on top of these slides is with the same donor, we did a follow-up survey to see the impacts of COVID, and we have learned that 70% of the adolescent girls from the surveyed group said education is their biggest challenge. 50% of the adolescent girls are caring for family members. Thank you.
Thank you so much, Alem. I'll now turn it over to our final panelist, Perna of ICRW Asia.
Thank you, Emily. Do I may request for the control of the slides? Thank you. Thank you, everyone. It's a great opportunity for me to present the Planet Girls program from India. It's a program which was aimed at empowerment and employability for adolescent girls. So before I get into what Planet Girls was all about, I think it's important to set the context for a program like Planet Girls. We are talking about a country where the labor force participation of women is declining constantly to the extent that in 2020, it went down to about 20%. And this is despite the fact that the enrollment rates in school are rising. A lot has been written about why this is so, but some of the key reasons for it is lack of access to higher education for girls, lack of access to skilling and employment opportunities for girls. Also, we are living in a country where gender norms kind of do not really support girls' aspirations. And because of the inherent inequality of the gender and the gender norms, it becomes difficult for girls to seek and receive support from within the household as well as in the market and in the economy. So this is a scenario that we are referring to. Within this, ICRW has been working with adolescents for quite a long time. And in 2013, we conducted a study which threw three key findings for us. One was that most often the onus of change and the focus of the program continued to be on adolescent girls, while they did not themselves have the decision-making ability, the decision-making right within the household. So it's the family and it's the parents that decide for her what she should be doing. Two was that most programs that were working with adolescent girls, while they were using the life skills to work with them and kind of equipping them with life skills, most often they were devoid of the gender lens. And that kind of left life skills almost gender blind. And that whole paradigm of using life skills and the approach of using life skills did not necessarily support girls' needs and the life skills that they required. And the third piece, like I said, because the programs focus particularly on girls, all other critical stakeholders, the parents who make the decisions, the teachers who influence their choices and their ability to seek support from others, also kind of seem to be missing, which left girls to just be equipped with some of the skills and then fend for themselves. To address this, we at ICRW Asia, we designed a program called PAGE, which worked with adolescent girls, and that evolved into what now today we are talking about, which is Planet Girls. Planet Girls is a multi-level, multi-stakeholder program where while the girl stays at the center, we also work with all critical stakeholders that are involved and have a huge influence on a girl's lives. Learning from our past experience and our studies, we also integrated gender into the life skills and the employability skills curriculum that we devised for the adolescent girls. To understand the impact of the program, we devised a quasi-experimental design because these girls whom we were working with were in grade 9 and grade 11, and we followed them through grade 10 and grade 12 respectively. We basically followed these girls even through our research and to understand what impact does the program have on them. The program was located in 2 sites, one urban, which is Delhi, which is the national capital of the country, and another, which is in Jharkhand, which is primarily a rural state, and very specifically in 2 districts where the rural population is much higher. And we were focusing on the rural side there. Just to give you a sense of what the program really did, we used the ecosystem approach. And like I said, girl was right at the center of the entire design, the program design. So while with girls, we used a curriculum that was essentially developed to equip them with life skills and employability skills with a very strong gender lens. With boys, we continued to use our flagship curriculum, which is Gender Equity Movement in Schools curriculum. And with parents, we had meetings in Delhi, mothers particularly. We also had workshops and regular sessions with teachers in schools. The community also became an important critical part of the design, and especially in Jharkhand, where we then ensured that there were adolescent-led campaigns and meetings with community members and community leaders. Because the idea was to equip these girls with also employability skills and give them the correct information and those linkages, we also engaged with local institutions of skilling and training, which then supported girls with not just information, but also local opportunities. Just to give you a sense of, sorry, there's a bit of a, just to give you a sense of what was the impact of the program, what we found was that the program had a differential impact on girls in different locations as well as in terms of the age group. So we found some significant improvement in girls' self-esteem, self-efficacy, but gender attitudes and family support. But it's important to recognize that, for instance, self-esteem improved across groups except for older girls in Jharkhand. Self-efficacy was really improved significantly among rural girls, which is again Jharkhand, while gender attitudes and family support improved significantly with the girls in Delhi. Similarly, when we looked at the employability outcomes, we found that economic self-efficacy and preparation to work was significantly high among younger cohort in Delhi, while it was very different in Jharkhand, where it was the older girls where we found that there was significant improvement in their career decision-making self-efficacy. Also, the older girls in Jharkhand spoke about how they found their school climate has improved over a period of time since the program has started intervening. Similarly, for younger adolescent girls, in Jharkhand particularly, they reported that their peer support, at least that's their perception, that their peer support has improved for education and work. While the program had these very significant impacts on some of the key outcomes that we were trying to measure, it's also important to look at, because we're talking about multi-level programming, between the linkages between some of these measures and what it really means. When we started to look at what are the critical factors that impact girls' aspirations, and we delved deeper into the data set, we found that while self-esteem and gender equitable attitudes have an impact on girls' aspirations, it is the family support and school climate which is equally critical for a girl's aspirations. When we were looking at what impacts career decision-making self-efficacy for girls, we realized that enlisting teachers' support and the perception that their school climate and their school environment provides them that support and is a safe environment also influences the career decision-making self-efficacy for these girls. What does it really mean in terms of how girls see this? One of the girls, an older girl in Delhi, particularly spoke about how she thinks it's important for girls to fight for their rights and how the program helped her understand that gender inequality is absolutely inherent in the society. And she believes that it is for girls to really fight it out and achieve what they want to. What is the implication of this in terms of multi-level programming and specifically for adolescent girls? We realize that while we have these different components which kind of complemented each other, it is essentially an integrated approach that worked for the program and that worked for the adolescent girls. The parental support, the school climate, supporting girls' aspirations and their ability to make career-related decisions is absolutely critical. And therefore, we see that there is a huge potential in terms of intergenerational programming, really harnessing the strength and harnessing the energy and the potential of mothers as possible allies for these adolescent girls. And in India, we have a very thriving women's collective movement, and maybe that is one direction that we should possibly think about. Also, schools as a safe space. So while schools tend to focus on curriculum and academic achievement, in which is absolutely necessary, it's also equally important that schools become a safe space by design. And therefore, we also need to invest in teachers and the heads of schools, and how do we ensure that the interaction between the students and the quality of interaction among all these stakeholders within the school as an institution also improve. I will stop here and happy to answer any questions. Thank you.
Thank you so much, Prerna, and thank you to all three panelists. We'll move on now to our moderated discussion. Please join me in welcoming our chair for today's discussion, Ms. Shubha Jayram of the Bill and Melinda Gates Foundation. Shubha is a program officer in the Gender Equality Division at the Bill and Melinda Gates Foundation, where she leads work to build the evidence base on women's collectives and group-based models to empower adolescent girls. She has more than a decade of experience in global development consulting, project and people management, and strategy development to increase socioeconomic impact and improve livelihoods. Thank you for joining us today. I'll turn things over now to Shubha, and then again remind people to post their questions in the Q&A function below.
Wonderful. Thank you. Thank you so much, Emily, for that welcome, and really a big thank you to everyone for being here. Good morning, good evening, good afternoon. It's really a pleasure to serve as a moderator for this conversation. And thank you. I'll start by just saying thank you for that fantastic set of presentations. Such a rich, interesting set of findings. I'm so excited to dive into this conversation. For this portion of the session, I'm so thrilled to invite Shubha Chakravarty to join us. She is a senior economist in the World Bank Social Protection and Jobs Practice in South Asia. She leads operations and analytical work on employment, livelihoods, and skills development with an emphasis on women's and girls' empowerment. Thank you so much for joining us, Shubha. Looking forward to your participation in this conversation. I'd like to also invite our panelists to also join me in this conversation. Please do come back on, turn your videos on if you're able. And looking forward, I think we have plenty of time now for a rich and lively discussion. So please, to our audience members, please feel free to continue to put your questions in the chat. I see we've already got a nice set of questions that I'll do my best to bundle and really hear from our panelists. I think the conversation was just fantastic. I think a few things that really came out to me as you were all speaking is really some clear threads in what you were presenting. I think all of you just emphasized the importance of multi-level, multi-layered approaches, engaging not just girls, but others in their community, others in their ecosystem. I think all of you worked with schools, you sort of addressed the school climate, worked with teachers. And I found it very interesting that a number of you also were able to look at some of those differential impacts and sort of differentiated results, whether it's rural, urban, or by the different arms that you'd set out. So looking forward to diving into those pieces. Maybe though, I'll start with first a question just to Shubha. Based on what we've just heard, based on your own work at the World Bank and elsewhere in this area, Shubha, what are implications and key lessons for policy and programming based on what you've heard?
Thank you so much. I hope I'm audible, and I really just want to thank you so much for the opportunity to join this session, and also to I just want to commend all three speakers on really excellent and informative presentations. If at any time I'm hard to hear, just someone wave or something so that I'll know to pause. So the thing that really came away very clearly from, having worked on adolescent girls programming for over a decade, the thing that really stood out to me about these 3 programs was the effective involvement and engagement of boys. This is something we've been talking about for so long, and it is really refreshing to see it happening across countries systematically in so many programs. So I really want to commend all of you on that. With regard to the question, right, around challenges around multi-level programming, I want to kind of separate programs that try to involve other stakeholders at the community level, such as boys or family members or community leaders. That's kind of one way of adding a layer or a level to your programming. The second, which is a very separate kind of challenge, is getting institutional services involved, things like schools, health clinics, right? That we've also heard some of these programs were also very effective and engaging, but it's a very different kind of challenge. There's a separate set of challenges involved with getting institutional or government services involved. So let's start with families, boys, communities. What I've seen in general is that with enough effort, with enough sensitization, with sometimes some incentives, right, to those groups, it is usually doable to involve and engage families, boys, community members in your adolescent girl programming. It's often NGOs, like many of the presenters today, who do this best because they have close ties to the communities. And in general, what I have found is that the biggest challenge is money, right? Making sure that the incentives or whatever resources you have to expend on the families, the boys, the communities, don't start to outweigh those resources that are going to girls directly, right? Many of us got into adolescent girls programming because there's a real problem that not enough resources are going to girls. And it's often very strange to communities and families to see all these resources going directly to girls, right? And so often to assuage their concerns or get them to buy into the program, we often end up having to divert some resources away from girls to meet the demands or the needs of all of these other groups. So I'm really curious to hear from some of the participants today about how did you, in designing these programs, I'm assuming you're working all in like very budget constrained programming, how did you weigh that balance of resources that are going to the girls, the primary beneficiary, versus all of the other community stakeholders? Why don't I stop there? I don't want to monopolize the time. If there's time, I'm happy to speak also about some of the challenges in getting government or institutional services on board in multi-level programming. Over.
Wonderful, thank you for that. And maybe I'll just pick up on that thread about boys, because I think that's absolutely critical. And as you mentioned, all 3 projects we heard from considered boys, intentionally incorporated boys in their design. And I think you sort of raised that challenge of how do you ensure that diversion of resources is sort of balanced, and there's sometimes a tension there. So maybe I'll turn it to our panelists. Would just love to hear reflections on what you've learned on engaging boys and men, the importance of engaging boys and men, and how you also balance that tension of sort of allocating the resources across different pieces of the program, particularly when it comes to boys and girls. And maybe Gcinaphi, I'll start with you, and then I'll turn to Prerna, and then I'll come to you, Alem. So Gcinaphi, over to you.
Thank you, Shubha and Shubha. For us, it was a long time coming for us to engage boys. We'd been in the empowering girls for improved health and well-being business, so to say, since 2008. So we needed to provide or to create another layer so as to extend the safe space for the girls. And as our main goal was to improve outcomes for girls within the school setting. And by extension, that also includes the community. So we were fortunate that it came at a time where the focus was sort of shifting, even in locally in Eswatini. Even the Ministry of Education is now taking a huge focus on boys, because we're seeing a lot of dropouts amongst school-aged boys. They're not transitioning from primary to high school. So we had although there's not a lot of evidence to support that, especially evidence, as you are aware, SWAGA deals with gender-based violence. There's not a lot of evidence for boys. So this was also an opportunity for us to sort of bring some evidence for the country and for the Southern African region. I hope I answered.
Wonderful. And Gcinaphi, there are a few specific questions I'm seeing coming from our audience related specifically to your program, but I'll come back to you in a minute. But maybe Prerna, I'll go to you now.
Thank you, Shubha. I think it's a very critical point that Shubha has raised in terms of what is the resource allocation. But I would just kind of take a step back and say more than the resource allocation, it's actually the objective which decides the resource allocation. So it's directly linked with what is it that you're trying to do. So if the focus continues to be on the girl and the girl is right at the center, everything else is complementary around the girl, and therefore it becomes absolutely critical to really look at it as an integrated approach rather than trying to, pull out these separate pieces. So, for instance, when we were working with girls and boys in community and local institutions and community leaders and parents, what we worked on primarily was the capacity of the youth facilitators, who were essentially the very foundation of the program. These are the people, the girls and the boys, young men and young women, who we then trained very well to ensure that wherever they go, they're able to have those conversations. And that is the resource that we invested in thoroughly. Their training, their capacity building, hand-holding them, making sure that they are able to navigate through this entire gender and social norms, because they come from the same communities. And so then they became the resource to really look up to and to deliver the program across these different pieces which are tied into each other.
Wonderful. Thank you. Alem?
Okay, thank you. Yeah, thank you. In the programs that we implemented, as I have said earlier, there were 3 components: the girls and is community groups, and those community groups are, for example, the men who are husbands or religious leaders, and the boys within the adolescent range, and sometimes in rare cases they are also husbands. And the others is a government response component. However, through the program, the learning that we have is because the project was, investing on the peer groups only on, adolescent girls, there was somehow a kind of resistance from the men. They were feeling, as if they are, not prioritized and neglected. And, they were saying that, the girls are being more skillful in terms of being confident and, have financial literacy and something like that. So they were asking again and again, the project team to also support or establish the boys groups. And at the same time, there were also being barriers for the girls from attending the session. They were distracting it purposefully because they feel that, you know, they are not benefiting. So what we, the big, I think, lesson that we took from our program is, I think they are, you know, really enabling. They can really play a very good enabling, you know, factor for the girls to have, you know, supportive environment, you know, for the change or for the new norm they are planning to bring. So I think male and boys engagement is, you know, a key components through within the multi-layer program. Thank you.
Thanks, Alem. That's really important. And I sort of hear you sort of saying by not engaging boys, they sort of were not fully supportive. They didn't fully understand, and sort of the importance of removing those barriers, misconceptions. I think that's very clear. I guess maybe just continuing this thread, I see we have some questions from our audience members. And so specifically on this topic, folks are asking, how did you engage boys in discussing social norms? And so specifically, how do you discuss social norms? How do you interest boys, put forward an atmosphere, environment where they can discuss sexual violence and get them to challenge these social norms? And I know that many of you did this in your program. So would you like to respond to that question? Maybe Gcinaphi, I'll come to you first, and then Prerna.
Thank you, Shubha. For us, how we engage the boys, first of all, our curriculum is one that's gender transformative. It's based on engagement and not necessarily on a classroom setup, even though this project is set up in schools. So even when we train our mentors, the approach, we conduct the trainings in such a way that we are sort of emulating what should happen in the club as well. So they are aware during the trainings of how the engagement should occur. So it's very much participatory, and it's one approach that is, if you were to sit in one of our trainings, you would even think that the content was meant for you, the way it catches one's attention and interest and makes one actually want to be involved. So our curriculum, for example, is we started out with some easier topics where we are looking at what's already on the ground in terms of our societal norms, what they know, what it means to be a man, what it means to be a woman, in a session called Act Like a Man, Act Like a Woman. And that sort of sparks that interest or actually increases their interest before we get into who the person is, who you are as a boy, what you aspire to do, how to build your confidence, and then making them understand the concepts of gender and so forth. So it's quite interesting to be part of that. We didn't do much in terms of incentivizing the clubs to them to sort of try and get them to participate regularly. It was based on the curriculum and the mode of delivery by the mentors. So as maybe this didn't come up, but mentors are young men and women aged 18 to 30. So they are not very old, and they are easily relatable to children. They're not teachers per se, or they don't even look like teachers. So they are young boys and young girls specifically girls, young women for girls clubs, young men for boys clubs. So it's easier for them to build that rapport. And what we've seen is it also creates that role model feel for them, for the participants. So even attending the sessions is because you are seeing this person who could potentially be a role model to you, teaching you things that you need to know on a day-to-day basis, content that's easily relatable in terms of decision making, building relationships, and so forth, particularly for the boys clubs. Yeah, thank you.
Wonderful, thank you. And I hear you touch on both the curriculum as well as the importance of mentors, having role models similar and near in age. Verma, do you want to come in? Anything to add from your?
I think it's a very similar experience that we also had in terms of engaging with boys. So while we trained these youth facilitators who were men of similar age group and slightly older, so they were role models to these young boys. But I think it's also important for me to specify here that when we were doing our qualitative study, we found that while boys kind of started having that conversation about equality and about the fact that they should not really engage in any sort of violence, whether verbal or, or any kind of sexual harassment with girls, I think there's still a long way to go in terms of making them understand or really working with them to ensure that they see a girl's role beyond the household. So what we found very interesting was that while they said, of course, girls should study, and of course, they should really be given a chance to fulfill their aspirations. But when it comes to really thinking in terms of what do they expect of their own partners in future, it all boils down to a good housewife and someone who replaces my mother, literally. So basically someone who takes care of the household. And therefore, I think there is a lot more that needs to be done with boys particularly. So while you had these role models and facilitators, we had a curriculum which was, essentially focusing on conversations around gender and work, and how is household work and work outside in the world is divided, and why why boys should not engage in violence, and having those very transformative conversations with them. I think there is still a long way to go.
Thanks, Verma. That's really helpful. Maybe I'll change tacks a little bit, and maybe another set of questions I'd really like to ask. And this is getting back to something Shubha also mentioned at the beginning, which is the importance of support at the institutional level. And I think that's critically important. And linkages with the state, linkages with the Ministry of Education. I know that that's something all of you did, engaging with government at some level. And so I'd love to probe on that a little bit. I know it can sometimes be challenging. I think it's hugely important if you're thinking about scale up. And so I'd like to spend some time on that. And maybe I'll invite Shubha first, just to come in on this. And maybe if you want to share some reflections on how do you engage with the state and government? How do you think about working at that institutional level? What point to engage?
Thank you so much. So this is really something that we spend a lot of time doing at the World Bank. I can give you some ideas from my own experiences on various adolescent girls projects or women's empowerment projects, but I'm also really curious to hear from the panelists how they engaged with government and how they how they overcame some of the challenges that I'll mention. So. In the case of most of our projects, right, we finance mostly government projects. And so it's usually a primary ministry that's involved in delivering whatever is the core service. If it's a girls or women's empowerment project, it's often a Ministry of Women or a Ministry of Social Affairs. Those are the ones that we often end up working with. Now, to get that ministry to then interact successfully with the Ministry of Education or with the Ministry of Health or with the Ministry of Agriculture, that is much harder. And that's where that multi-level comes in, right? Because the multi-level of institutional services often requires interministerial coordination, which is challenging even in the, even in like very high income countries, every country, this is a huge challenge. And so the first challenge often comes down to money, right? I can't, the schools, the health clinics, the agriculture ministry, they can't take any action without somebody financing whatever activity it is that you want to do. But even assuming that you have enough money, which is a big assumption, but even when you do, even when you have, and even when everybody is acting, everybody is committed, nobody is, trying to undermine, everybody's on board and everybody's working together, there is just simply a lot of work involved in interministerial coordination. There's a lot of paperwork, for example. I was working on a project, for example, in Southern Africa, not in Eswatini, in Southern Africa, where we were running women's livelihood groups, and we wanted the local agricultural extension agent to come in and give sessions, right, to help women know about what kind of services were available to them from agricultural extension. And the amount of time it took, even though we had the resources, to get one ministry to be able to pay the fuel costs of that agricultural extension agent to be able to ride his motor scooter to the communities to visit with these women's groups was astounding. It took months just to get that paperwork sorted out. We have a similar situation in India, getting, linking girls from a girls' club to to open schooling initiatives, right, to informal education initiatives. Everybody's on board. There's enough money. Everybody wants to make it happen, but just it's not anyone's fault. It's just literally not how governments are set up to function, right? Governments operate so much in silos, and it's just not. It's not how they're set up to work. So that's really, some of the experiences that we've had with trying to get institutional services layered in to these kinds of programs. I'm really curious to hear from the participants or from the panelists how they approach, whether they had these challenges and how they approached them. Thanks so much.
Thank you, Shubha. I think that's really helpful and really great to have that insight from your perspective. I'd like to turn it over now, maybe Alem to start, and then we'll go to Prerna and Gcinaphi. Just how you tackle this? Was it a challenge in your program? How you approach that? Alem.
Okay, thank you. As our colleagues said, the government officials actually working, even though they are working on the same agenda, they usually work, on silos, and that has also its own challenge in terms of creating really the importance and enabling environment for the girls. So what we did in Abdiboru is within Abdiboru, the health sector, the women, children, and youth affairs ministry, and education ministry was a part of it. And the way how we approached it is in terms of having interface meeting, with the girls. And the first thing that we have faced is, for example, for the interface meeting, they have never had been a kind of evaluated or by a very young adolescent girls, and they were saying no, you can't bring us with this very early age to tell us what to do, to tell us how our service to be framed and something like that. But so we did a different level of advocacy and lobbying, and the discussion with about the importance of engaging girls in this kinds of intervention. And finally we reached into consensus. Okay, that was good. And the other challenge that we faced is through this ministry, administrative unit of each district was part of also that interface meeting, and the sectors were not really happy about being with an interface meeting between other sectors. They felt that, they have been told about, the things that they are not performing well in front of a large audience. So then again, what we did is we want that, jointly, joint, platforms and, discussion with the girls. And again, we have discussed, it's not a one-time kind of discussion, but with the support of higher officials from, administrative unit, the administrative unit that is supervising all sectors was, there, and, they were, supporting us and, telling them, the importance of coming together. Then, we have started really a very strong and a very good, impacts through, bringing all the sectors, together. Because even though they have policies, it was separate, it was, they don't read each other. One sector did something and the other sector did another thing. So it was also, very supportive for the girls, but, bringing them was really helpful, even to have a mutual and agreed plan in their annual plans. That's what we have seen, and it was really a very good experience in Abdibo. Thank you.
Thank you, Alem. It's interesting. I mean, as you were speaking, I was thinking it was part of something you had to do, bringing together people who wouldn't normally talk, bringing together ministries who wouldn't normally connect. And that was almost built in at the very beginning, is what I'm hearing you saying, which is hugely important. Maybe Gcinaphi, I'll turn it over to you with your reflections on this point, working with at the institutional level, with government, different ministries.
All right. Thank you, Shubha. For us as SWAGA, we have a very good working relationship with the Minister of Education and Training. So we, as an organization, we've supported girls empowerment clubs in close to 100 schools now over the past few years. So what happened with us when we started this project, it was at a time when we needed to incorporate a self-efficacy module into our existing curriculum. And so we approached the ministry, and it was at a time where they also set sort of a standard of what needs to happen for an organization to go into a school and be allowed to work in schools. So we followed that process, and it took a little over, I think it took about 18 months, where we had consultants developing and revising our existing girls empowerment curriculum and developing the Boys for Change curriculum. We saw that it was a process that worked best for us because the ministry was very much a part of that. So as we speak, SWAGA is actually the only organization that has an approved curriculum to work in the schools, because we worked with them for that. So what happens is they convene what is called a subject panel that is that consists of a different number of departments within the Ministry of Education and Training. And we present our materials, they review, critique, take out a few things here and there, and it's quite a lengthy process of meetings over a few months. And this subject panel also has police represented, UNESCO, who works very closely with the Minister of Education, is also represented, as well as someone from the health sector, and an NGO representative is also part of that. Moreover, we are also, as an organization, been around for 30 years, and we have sort of grown roots and cemented our name in the GPV sector. We are the lead organization, and we do work well with the Deputy Prime Minister's office, who is the custodian of issues of gender-based violence in the country. So with the department, with the Deputy Prime Minister's office, we also have what we call regional networks on violence. And this is a coordination structure that brings together different organization stakeholders working on GBV and to coordinate on issues of GBV, violence against children. And most recently, we started a project that focuses on adolescent girls and young women with disabilities. So those are also brought into to that. So it's not one project, although this particular project supported those networks as well. It's not one project that's focusing on that. As well as the Ministry of Health, we did engage them. We did have a bit of a challenge with that particular ministry because our initial project design included getting statistics from local clinics of adolescent girls and boys who would seek services in those clinics. However, it was a lengthy process of engagement, of back and forth, and we got to a point where we had to try and get that information in other ways, which weren't exactly effective. We also then, towards the end of our implementation period, which was about 20, it was 2 academic years, but it was 18 months if you count it like that. Towards the end of the 2 academic years, we got a sense of acceptance of what we wanted to do, and they allowed us to train the healthcare workers. So we couldn't really do much with them over the period of implementation. However, with the Ministry of Education, there's talks even now for upscaling the project. I don't know if I'm allowed to say this, but I know the World Bank is supporting the ministry in doing that, in rolling out the girls empowerment program as well as the Boys for Change clubs in I think 100 more schools. That's the plan. It's not finalized yet, but we are hoping that's gonna happen soon. Yeah, so we do have quite, although, as I have mentioned, with all the different sort of fora or consortiums that we have, all these ministries that we work closely with are represented. And at that forum, we work well together. It's when we get out of those meetings and those platforms where everyone then goes back to their corners. But individually, we do have quite a very good relationship with all those key ministries in terms of our work. Thank you.
Wonderful. No, thank you, Gcinaphi. That's fantastic, and congratulations on sort of the scaling possibility, and just, I think you'd also mentioned, you have the only approved curricula to sort of work in schools. That's just simply fantastic. I think it's testament to all of the work and the dialogue that you've also initiated and fostered. Maybe Prerna, I'll go to you, and maybe if you can also touch on how Planet is thinking about that sustainability piece and that scalability piece, that would be helpful as well. Maybe I'll give you 2 minutes.
Sure, thank you, Shubha. So like Gcinaphi was saying that, working with government and having good relations with government is very, very critical. But in India, education and livelihood are state subjects. So we don't necessarily, while we have national policies and guidelines as to how the state should proceed, it's really the states that we have to engage with very, very closely. I can give you an example of Jharkhand, for instance. When we were working in Jharkhand, in one particular district called Pakur, which is primarily a tribal district, has a huge tribal population, and one of the poorest districts, there we were able to really have a great relationship with the district level officials from the education department. And I think one of the experiences, just kind of referring to your previous question, one of the experiences that we had was that locally it becomes easier for us to engage various departments and kind of make sure that we are able to facilitate a conversation between these different actors. From a sustainability perspective, what we were able to do while we were focusing on very specifically on our intervention schools, in our conversations with the district education officer, we realized that there is a need, and which was an articulated need from her end, to really engage with the residential schools for adolescent girls, and where primarily it's the tribal girls who come and stay and study. What we were able to then do is that despite the fact that we had very specifically designed the program in a certain way and we're focusing only on intervention schools for all other components, we were able to bring in the teachers from these residential schools to the trainings for teachers. And that became our first point of sustainability. In fact, recently we also did a quick webinar with the teachers in that particular district. And we realized that there's so many testimonials about how learning from those workshops that they engaged in, they've been able to really take it to their own classrooms and implement some of those practices within their classrooms. At the same time, what we also did was we collated several resources. So one big resource that we collated was focusing on the local opportunities that are available for girls for higher education, for skilling, for training, and created this resource bank, which we left back in the schools for the schools to be able to use, for the teachers to be able to use, and the students to be able to access. Similarly, we designed a resource book on gender responsive classrooms, which again, we kind of worked very closely with the teachers on that and left it back again as a resource for them to use and start using those practices in school. In terms of, I'm going to take just half a more minute. I know you had said 2 minutes. In terms of scalability, we are already having conversations with the Jharkhand government and also thinking as to how can we integrate a lot of this learning in the existing programs rather than trying to create another parallel system. So for instance, the gender equity movement in schools curriculum, we already have some components of that integrated into the textbooks of Jharkhand government. So that is the approach that we at ICRW. Thank you.
Wonderful, wonderful. Thank you, Purna. I think this is such a rich conversation, and a lot of what you've said, I want to pick up on it. Sort of how do you engage with teachers? How do you create that safe space in schools? And I know we are short on time. I feel this could easily be more an hour longer. But I will say, in the interest of time, we are going to have to cut this short. I will give each of you just one question. And I literally want one sentence or one theme, but I think something I'm left with at the end of this conversation, and there's so many pieces we didn't touch on. We didn't touch on cost and cost effectiveness. We didn't touch on how do you make schools a safe space. We didn't touch on sort of programming, how it's been adapted, implications of COVID. I think that's huge, and we just didn't touch on that. But maybe as we conclude this portion of the session and wrap up the conversation, if there is just one question on your mind or one theme on your mind that is left in terms of as you think about scaling and sustaining and really reaching more girls, really empowering more girls and scaling up these multi-level, multi-component programs to empower young girls, what is the key question in your mind that's critically important to answer, that's important to tackle, or something that you're left with at the conclusion of your projects as you think about what's next? So one key question, one key theme. I will give each of you less than a minute to respond. And maybe Shubha, I'll start with you at the bank. Just what's on your mind? If you, just one. There's probably dozens. Shubha, you may be on mute.
Shubha says she's having some audio problems, so let's start with somebody else.
Okay, thanks for that. Maybe Gcinaphi, I'll start with you. in 30 seconds.
Okay, I think for us, the biggest theme we are learning that for adolescent girls to have better outcomes for us is to make sure that we use all levels that we can be possibly targeted: institutional, community, societal, and down to the individual as well. In particular, parents play a big part in that, and our focus for this year is involvement of parents, and not just the wider community focus on caregivers and parents.
Wonderful. Thank you, Gcinaphi. Verma, over to you.
I think I'm going to just build on what Gcinaphi said, and I also kind of concluded my presentation with. I would want to really understand how can we harness the potential of intergenerational programming, because we're talking about parents' involvement in their child's life, and often these conversations between parent and child do not necessarily happen around their aspiration, especially when it's girls, because it's kind of understood what she's expected to do. And how can we really strengthen a program like Planet Girls to achieve the outcomes of empowerment and equality? I'll stop there. Thank you.
Thanks, Verma. And Alem?
Thank you. In terms of actually sustainability, I really want to learn more about how much of how much involvement of these multiple government sector is enough really to sustain these kinds of projects. We have seen that there were throughout projects there were a joint plans in their annual plan. It can be even also scaled.
Wonderful. Alem,
don't tell it.
Wonderful. Alem, I think I'm losing you a little bit there with connectivity, but I think I got what you said. Super. Thank you so much, Alem. I think I lost a little bit of what you said at the end, but I think your point on sustainability and involvement of different layers and levels, I think I got that. So thank you for that. Shubha, are you able to hear us? Any sort of parting, very quick 30-second themes, questions on your mind that you're left with?
Yes. So thank you, and I'm sorry about the audio problem. I think one of the things that I would take away, and I hope we all do, and that relates to this theme of multi-sectorality, is really staying laser focused on the result you're trying to achieve, and being open to the possibility that the result may not come from your sector, may come from an activity or an intervention in a different sector. I think one example of this is all of the evidence that we've gained over the last 10 or 20 years, really, about promoting girls' schooling, right? To improve enrollment of girls in school. The solution doesn't necessarily have to come from improving the school. A lot of times a cash transfer from a totally different ministry and alleviating household, just economic constraints can really, achieve achieve these gains in girls' enrollment that we were all hoping to see. And that can't happen without this multi-sectorality in our programming. That's what I wanted to highlight. Sorry about the audio again.
No, thank you. Thank you so much. This has been such a fantastic, such a rich discussion. As I said, we could have easily spent another hour, many topics we didn't have a chance to get to, but just I want to conclude by saying really, A huge thank you to Alem, Gcinaphi, Prerna, Shubha. Thank you for joining. Thank you for this conversation. And now I'll turn it back to Emily.
Hi, thanks, Shubha. And I'll just echo what you said. I think, thank you to the panelists and also to the audience for your interest in the many, many questions that you submitted. I hope that we were able to address the majority of them. We are going to do our best to address the remaining questions offline, and we'll be sharing around some of those thoughts and answers at a later date. We'll do our best to get to as many of those as we can. So now I'd like to invite Catherine Haye for closing remarks. Catherine is the Deputy Director for Gender Equality at the Gates Foundation, where she leads initiatives for women's economic empowerment, including strengthening gender data, addressing barriers, closing gaps in employment, and enterprise and scaling platforms. Welcome, Catherine.
Thank you, Emily, and thanks to all of the panelists. I've really loved this session, and I've loved that there was actually time for the discussion and having some of the great questions that participants posed answered. I thought it was such a rich session. So I hope I can do some justice in just these sort of final closing thoughts to bring this home. But it's interesting for me coming back today with our partners. It's taken me back actually to when we chose these ideas, for some of you, you're not necessarily part of working at a funding organization, and it's probably quite opaque. How does it happen? How do these ideas get selected? So, just let me take you back. I think it was maybe six years ago, half a decade ago, when we put out a call as part of what we call sort of grand challenges. And so there's lots of ways that we make investments and develop partnerships, but sometimes what we do when we feel like there's a problem that needs new creative solutions and where we don't have a really clear plan and we don't know what the blueprint is for moving ahead, we do something that we call grand challenges, and where we simply say, give us your new ideas, and we try to make it as easy as possible for those new ideas to come in. People send in short concepts. We don't make it so tied to our particular vertical programs, and we simply say, what are your ideas that actually can address these problems and put women and girls at the center of development? And this particular call, I believe, still may have received the most concepts that we've ever received. I'd have to go back and check that, but it was, there was thousands. And so what do you do when you get that many proposals? And these are short concepts. Well, what they do at the Gates Foundation is they fill rooms with snacks, chocolate, like cheese, like all kinds of snacks to basically keep you in the room. And you sit in the room with colleagues, and we do this in places around the world. And you go through these ideas, and all of them are sort of reviewed by multiple people. And some of them are funny, some of them are completely sort of over the top, novel, but the whole point is to get in new ideas and just to challenge ourselves. And so it's fun for me to think about being in that room and sort of going through these stacks and stacks and looking for just some of those new ideas, and then to be sitting now and having seen those ideas turn into real programs with real girls and real results. And I'm reminded of a quote that Bill Gates said, and I've heard many times over the years, and it's that most people overestimate what they can do in 1 year and underestimate what they can do in 10 years. And so we're not quite at 10 years, but we're getting there. And I think we just don't often get time to stop and think about the work and those timeframes and what we can do in 5 years, and what it takes, though, to go from a set of ideas on 2 pages from around the world to bringing those ideas alive, to taking those ideas, building it into programs, working with girls, having them shape the programs, getting research designs in place, building partnerships with government, rebuilding partnerships with new governments, and all the other steps and hurdles along the way. And then also building bridges between these countries and research teams and groups of people that didn't know each other before, but wanted to also learn together. And so it's just been great for me also to sort of think over the course of this morning here in Seattle, about that journey. A couple of other just thoughts. Certainly I can say, having been in lockdown myself now for a year with 2 adolescents, hats off to our partners who work with adolescents all of the time. I can certainly say, both from the literature, but also my personal experience, that adolescents don't want to be programmed. So their engagement, their agency, they want to be part of solving problems together. And we know that also, works, that in doing so, they build those key skills that we've been hearing about today in terms of negotiation, confidence, etc., that can then enable them to handle all of the, or some of the many challenges that they're facing during that very complex and challenging period of their lives. I'm not going to go over sort of what we heard that matters in terms of the programming, because I think we got a lot of that today, but just a few things that sort of stand out to me, really from these efforts, as well as sort of other efforts that we've been involved in, is that, adolescents and adolescent girls, generally don't want to be brought together to just be, because they're seen as a problem, or there's some particular problem, a health problem or a social problem to be addressed. They don't want to be a problem to be addressed. I think they want to come together to, achieve their aspirations, and because they're seeking opportunities. And so I think for us at the Gates Foundation, when we are trying to address real, health challenges or problems or real barriers or gaps, I think we're trying to do that more and more by thinking about, well, how do we bring together, say, need for sexual and reproductive health services with their economic aspirations, their career aspirations, and how do we try to think about these kinds of programming differently? Again, I think today was really focused on this idea of the surround sound, and neither can you just work alone with adolescent girls in isolation. You do need to work on that surround sound, but at the same time, how do we just also make sure that a group that have been, underinvested in, that we don't start drawing away those resources, and targeting them to others, and that we're not building. At the end of the day, we want to be building, programs that are really centered around adolescents, that really put adolescent girls at the center of decision making, designing, and we want to see the resources go there. So I really thought today's discussion really got at that nuance, that it's not an either or, but that it's really about doing that very thoughtfully. I think, some of the work also on norm change is also showing some really interesting ways, both how norms kind of hold back some of these changes, but also some of the ways that we can, with even low resources, create support in that larger community without, again, taking those resources away from girls programming. So I think there is more to be learned on that. Clearly, I mean, one of the things that I think was really, a rich part of today's discussion is that tension between what we know is needed in terms of both the surround sound, the multi-layered programming and multi-level programming, the need to have programs that are adaptive and, bespoke, and that can vary based on what are the particular needs that adolescents are experiencing in the particular context. But we also know that adds complexity to anyone who's built, designed, tried to run a program. And we also, in our desire and our quest for scale, the ever elusive scale, we also know that the more nuanced, multifaceted, complex a program, the more difficult it is to scale. And I think we also heard a lot today about the challenges when we look to government to scale, the challenge of that's kind of not what governments are necessarily good at, and what they tend to be better at delivering are simpler, less complex, less varied, sort of more vertical programs. But I think the other important thing to really remember is that in most countries around the world, including in high-income countries, the kinds of programs that, described here, which again, in high income countries, we also have programs, targeting some of these same issues: early marriage, sexual and reproductive health of adolescents, etc. I mean, they don't tend to be delivered by the arm of government either, right? They do tend to be delivered by non-governmental organizations, community organizations. Now, of course, they're linked often to government services, often funded through taxes, through government programs, etc. So I think we also need to be creative about how we think about scaling in the role of government and go beyond sort of thinking only of government as the delivery model itself. And I think we got a lot of interesting ideas today to help push our thinking forward. Finally, on that creativity, I'd just like to end with a few words overall on the value of implementation research, or sort of doing the work while we learn from it, which is something that, I certainly have focused most of my sort of work and career around. But when I look back and I think back to sort of half a decade ago, when we were looking at these concepts and looking at these needs of adolescent girls in these different contexts and in the concepts that we were reading, I mean, these girls were at that time maybe 12 years old, 14 years old, 10 years old. I mean, these girls are now 18, some turning 20. At that time, we had a lot less understanding on how to build these types of programs. And I think today we've heard and seen that these young women received real support, support that helped them during a period of transition in their lives. But they also gave us something. Their experiences working with all of you, being part of your programs, have given us new insight on how the next generation, maybe their sisters, younger sisters or cousins or their daughters, will be supported. And perhaps even some of those original participants might be part of designing and leading those new efforts. So, I'd like to start by thanking all of the participants, the adolescent girls in these programs. And I hope maybe some are listening, or maybe one day they'll see this recording. And I'd like to thank them for letting us learn, and I hope improve from their experiences of these programs. And that's, again, one of the things I love about implementation research, that you get a chance to impact and work with and support real people in real lives, but in doing so to generate insights and ideas that can hopefully be scaled and integrated into even larger programs. So really excited to hear today about some of those scaling plans. We also couldn't have expected many of the challenges seen in these different countries and teams, of course, the pandemic, but many of the programs have also had setbacks and challenges before that. So I'd also really like to just thank our partners for their commitment to this work and these issues and their communities, and to sharing their learnings, their commitment to learning across geographies with each other throughout. And finally, to our partner, ICRW, thank you for hosting all of us here today and letting us all learn together from this journey.
Thank you so much for those insights, Catherine. And thanks again to all of our panelists and speakers for their time today. I'd also really like to thank the ICRW communications team for helping make sure things run smoothly. And of course, to everyone in the audience for your interest in the many, many questions that we received. Unfortunately, that's all the time we have today. But as a couple of people have mentioned in the chat, we do have another session coming up next week. So please check that out. And please check out the resources that we've shared in the chat. Keep an eye out for some follow-up materials, and enjoy the rest of your day. Thanks so much.